So we today have Dr. Akash, who is presently doing emergency medicine from AIIMS Delhi, and we are very delighted to have you for interview with us. Please introduce yourself.
Thanks, man. I'm Akash. I did my UG from private medical college, SRM Medical College in Tamil Nadu, and I am from 16 batch. I did in my first attempt, I scored around 1,500 something, and I didn't took any seat. Then I started preparation again. Then in May, I couldn't be able to focus properly due to some family issues. And in my and in next preparation only, I scored this rank and got my seat.
Great, great, great. So, how was your private medical college? I mean, how was their studying conditions and everything?
Uh, in my college, it's quite okay. So it's academically too oriented, and it conducts internals. It's too strict only, and we can't escape from that internals. They can send your internal score to your parents too sometimes. So we have to study from your UG too.
Okay, then I mean, it is much better than our government setup where they don't have any communication with parents. So, when did
Yeah,
you?
and not always, but sometimes.
Yeah, 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 you can say, what are you saying?
Not always they send you, but sometimes.
Okay, okay. So, when did you started preparing seriously for this NICT?
Hmm. So in my May initiative, no, I got around something 2,500 or 2,600 something like. Then I appeared for the on-spot round in um, on-spot round. I appeared where I didn't got any seat. Okay, then I got really upset and I got really depressed for next 15 days. Okay, then okay, this time we have to start preparation so vigorously and we have to start so seriously. Then I put my own schedule for the another 3 to 4 months. Then it all came up in a sudden. It showed up.
Mm,
My my serious preparation was only around 3 to 4 months only.
great, great. So, how was your, I mean, how you transition from your UG college life to the for preparation for INICT? It's a very serious or hectic preparation, and UG is kind of fun, like, so how you prepared yourself?
Sorry, in my UG preparation too, my college senior got radio in AIMS Delhi when I'm in third year. He is a real motivation. Okay. Then my immediate seniors got PJ Chandigarh. Okay. Then every of my seniors got it somewhere in a central institute. Then I thought myself, okay, you can do somewhere better too. Then you start preparing right from the third year. Then I started preparation in third year. Then made my notes from third year and final year too. Then CRRI, I didn't do much, just putting a basic questions in Marrow stuff. And my serious attempt start from 2023 only, I think. The first attempt, no, I got 1,500. That was my serious attempt. There I learned a lot. For example, how to approach the question, how to approach for the initiate, what are the basic things to be done before approaching the exams. All those I learned in the 6 months only, which helped me this in this preparation.
Okay, okay, great, great. So, what were the sources you followed for this preparation?
Um, I followed Marrow Cubans only, Plan B, then Bhatia White Session, then BTR, Unacademy BTR.
So it was not only BTR, you accessed all the collective resources.
Yeah, exactly. Mainly, I followed that MER series and MKT series from Unacademy.
Okay, okay. So, I mean, what mistakes you did in your earlier attempts, which you corrected in this attempt?
Sir, in previous attempt, I focused mainly on studying one notes only. Okay, we have to rush all the things in the notes and do Q banks only. This is a basic mantra I have followed. Then later I followed, okay, this is not only enough. We have to add some more. Then I made my notes so concise to be revised in the last 10 days. Then I revised in this attempt for the last 10 days. Most of the subject I revised in around 5 to 6 days. So I covered 15 to 16 subjects, which pushed my rank.
Great, great. You give your GT regular, or it was intermittent, on and off, like, I mean, what was the frequency?
Yeah, I'm not a much of GT lover. I actually do once in 15 days or something like once in 2 weeks only. That is not too regular, but I usually do in live only.
Okay, okay, okay. So, I mean, how was your score and how was your rank in those GT?
Sir, actually, I do custom models more a lot, and on subject-wise test, I do 3 days once or 4 days once. Most of the subject test, I could score around 100 to 200 ranks. Sometimes it goes around 500 in subject test. Okay, whereas in GT, I could score less than 800 or 1000 something.
Okay, okay. So, what was your score in NICT? You saw your score?
Score means you are asking for percentile or something? What?
No, no, no. This time they give marks also, no?
Around 138, correct, I think.
Okay, okay, fine. So, how much you attempted? I mean, there are two schools of thought now that we have to attempt 190, or we have to attempt only those which you are knowing. So, I mean, which one to follow?
It's all about the mindset, how you approach the exam. In the last two attempts, I attempted around 190 only. Then I got something around 1500 or 2000 something and getting up in anesthesia only. Then this time I thought, okay, have to attempt more something. Then I went around 199, 198 I attempted.
Okay, you followed. I will attempt maximum in whichever I can.
Maximum. Even one option you can eliminate, you have to attempt that
Okay, okay. So, why you opted for emergency medicine?
one. Sir, I like more of a shift basis duty rather than you have to work for all the basic investigations or evaluating the patients. I like more of a 6 hours duty and 8 hours duty. Then you can chill, man. What's the point of doing all the 24 hours duty? Yeah, I like more of a medicine guy, but I didn't get the medicine in my rank. But then I shifted my mindset. Okay, emergency medicine, how is it? And my professor actually did the emergency medicine from Jipmer. He inspired me a lot.
Okay, so I mean, you loved medicine also. So, I mean, you would be getting
Yeah.
medicine in peripheral aims also at your rank, I guess.
Yeah, maybe, but okay, no, but I didn't thought much of when it comes to the AIMS Delhi.
Okay, your dream was to be in AIMS Delhi. Great, great. So, uh, what is your message to the juniors who are preparing, and especially from private colleges? Because I have seen students from private colleges that they have kind of not so much having confidence that they can crack this exam and all.
So basically, you have to be consistent and do things regularly. Okay, first things you have to maintain is your notes only. First, once you are done your all your notes, then it's okay. Rather than studying for all the BTR and DVT or something other stuff, make your notes so concise and to revise in the last 10 days. This is much more enough and be consistent. That is me.
Okay, it does not. Okay, we get it. That it does not matter where you belong or where are you doing your undergraduation. It is your approach
Yeah.
to the exam. How much are you concising the notes? Great,
It's
great.
all depend on your notes only.
Yeah, most of the people that I've interviewed, they're all focused on that. We should have those concise notes for the last 10 days and all.
Yeah.
So, I would like to ask that is BTR alone enough that we or we should pursue more diverse? I mean, many people are there that they are following only BTR and only BTR and nothing else. So, do you think that BTR is sufficient, or we need to supplement it from other sources?
So BTR is actually something you have to most of factual based learning in the last 10 days. These are when you want to more of a concepts like NCERT, you have to study the basic subjects like first year and second year, then add on points from the BTR. BTR alone is not sufficient to crack the NCERT exam.
Okay, okay, great. So, you are 10 days into the emergency medicine. So, how is there? I mean, how much toxic is there, and how much, I mean, learning going on?
Sir, we from next week only we having academics. From from my date of joining till now, that's I didn't experience any toxicity. It's a social department, and you have a shift basis duty, either 6 hours or 8 hours something only. Then we can do whatever we want after this duty, and no one can call you.
It's great. I'm in a clinical branch setup that nobody calling you after 8 hours. It's really great. It was it
Yeah,
was really great to talk with you, Akash. And thank you for giving your precious time.
thank
Thank you. Thanks a lot, man.
you. Okay,
Oh,
yeah, no problem. Thank you,
oh.
and you are doing great. Thank you.